So I'm here to tell you about how MANNA is using cost-saving analysis to change the way healthcare looks in this country. So what MANNA does is MANNA provides medically appropriate meals and personalized nutrition counseling to people who have life-threatening illnesses. And to show you why that's necessary, I want you to put yourselves in the situation that our clients find themselves in. Imagine you're in a doctor's office and you've just been diagnosed with a life-threatening illness. Imagine you've been told you have renal disease and you need to follow this really stringent treatment plan. You need to go in for dialysis 3 times a week. You need to take these medications twice a day. And you need to eat a diet that's really important. It needs to be low potassium, low phosphorus, and low sodium. So you can go to the pharmacy to get your medications, and you can go to the treatment center to get your dialysis, but many people don't have anywhere to go to get that diet. And that's where MANNA comes in. MANNA provides that medically appropriate, personalized diet, home delivered to our clients. And we know that with this diet, our clients are actually able to fully heal. And like many nonprofits, we've always believed that we were an essential part, we were filling an essential gap in the system, and that this is definitely saving the healthcare system money. But we were actually able to quantify this by comparing health insurance claims of our clients to claims of a similar control group. And what we found was pretty astounding. We were not only saving money, but we were saving a substantial amount of money. That 62% that you're seeing, that's an average monthly healthcare saving that came out to about $30,000 per client per month. And what this did was it opened the door for a partnership between MANNA and Health Partners Plans, an insurance company that began referring members to MANNA in 2015. And MANNA, this initially started as a pilot program for patients with diabetes, and it quickly grew. And this was groundbreaking not only because it was the first partnership of its kind, but it was because MANNA had finally been able to demonstrate the economic value of our model and then secure the investment of an insurance agency who would benefit from and then continue to measure and track that economic value. This partnership, the success of this partnership, led to new partnerships between MANNA and other insurance agencies, including Keystone First and Aetna Better Health, and we're now in final talks with United Healthcare. And as we've seen our fee-for-service program grow and succeed, we've realized that our model is not only life-saving, it's not only cost-saving, but it's also imminently scalable. We've grown our ambitions from serving the 9-county Philadelphia-based region where we've always been focused to reaching people across the state of Pennsylvania and ultimately across the country. And for that to succeed, there are 3 key factors that we believe are important. The first is that nutrition needs to be elevated in the field of medical science. This means that when doctors prescribe their patients medications, they need to also recognize when it's appropriate to prescribe nutrition. And then the second piece of that puzzle is that the insurance policies that cover the medications and the medical treatments necessary for patients to heal have to also be expanded to cover the nutrition necessary for those treatments to work in the first place. And then, of course, the third is that we need the continued support of the philanthropic community, not only so that we can continue to serve clients regardless of whether or not their insurance policy covers our program, but also so that we can build our own organizational capacity to reach our goals. And a huge aspect of building that capacity is data management. We needed to be able to show that that study we did initially that found that huge 62%, that needs to be shown to be replicable. We need to be able to show that our program works consistently, and for that we need a better software system. We need technology. For a long time, MANNA has been operating on a program called Meal Service, which was designed for us in the 1990s by a one-man shop software developer for program logistics. It helps us schedule deliveries, keep track of which client gets which meal. But we needed now a new software that can do data and show that our program works for our clients, that can do health metrics, it can measure lab values and how they change over time. And thanks to a Catalyst Fund grant from the Barra Foundation, we're now in the transition to that technology. This has been a challenge. As was mentioned before, we are experts in health and nutrition. We are not experts in technology and transitions to new technology. And there's a lot that goes into moving from a database you've been in for 20 years to a new robust data platform. And we've actually brought on the person who designed and supported Meal Service as internal IT support to get us through this project. But the light at the end of this tunnel, of course, is that when we have this new platform in place, we're going to be able to show definitively, to build on our body of evidence, that food is really medicine and that it needs to be available nationwide to people who are sick. And this is a time for healthcare improvements. Our country spends more money on healthcare every year, and there's one trend that continues to grow to be an issue, and that's the super utilizer trend. Superutilizers are the very small portion of the sickest people in our country who account for a very large portion of our healthcare spending. And this is actually where you find MANNA's greatest success stories. It turns out that when people are back and forth in treatment, often it's because they don't have the nourishment, their body doesn't have the nutrients to succeed in treatment. So we have to think, if we look back to that 62% cost savings we found and applied it to superutilizers across the country, could we not only enable people to survive and thrive beyond illness, but could we save billions of dollars in the healthcare system at the same time? We believe we can. Thank you.